Hello everyone, welcome back to the channel. Have you ever felt like you can't take a full breath? Do you often find yourself taking deep breaths repeatedly but still feel unsatisfied? Do you experience chest tightness or feel short of breath while walking? If your answer is yes, then this video is specially for you. Today, we are going to discuss one of the most common medical symptoms, difficulty in breathing, also known as shortness of breath or dyspnea. We will cover what it actually means, its common causes, risk factors, diagnosis, treatment options, home care tips, and most importantly, when it becomes a medical emergency. So let's begin. What is dyspnea? Many people believe breathlessness itself is a disease. Actually, it's a symptom. Dyspnea simply means a person feels they cannot get enough air. You may notice difficulty taking a deep breath, chest tightness, rapid breathing, or increased effort while breathing. Sometimes it occurs only during exercise, sometimes even while sitting or resting. The important thing to understand is breathlessness is your body's way of telling you that something needs medical attention. Finding the underlying cause is the key to successful treatment. Let's discuss the most common causes. Asthma. Asthma causes narrowing of the airways. Symptoms include wheezing, cough, chest tightness, and difficulty breathing. COPD. COPD is commonly seen in smokers or people exposed to long term air pollution. Patients often have chronic cough, sputum, and gradually worsening breathlessness. Pneumonia. An infection in the lungs can make breathing difficult because the lungs cannot exchange oxygen efficiently, usually accompanied by fever, cough, chest pain. Viral infections. COVID-19 and influenza can also temporarily reduce lung function and produce breathlessness. Heart disease. Not every breathing problem starts in the lungs. If the heart cannot pump efficiently, fluid accumulates inside the lungs, making breathing difficult. Anxiety and panic attacks. Anxiety can cause rapid breathing, chest tightness, and the feeling that you cannot get enough air even when oxygen levels are completely normal. Anemia. If your hemoglobin is low, your blood carries less oxygen, causing tiredness and breathlessness. Pulmonary embolism, a blood clot in the lungs. This is a medical emergency. Sudden severe breathlessness, chest pain, and coughing blood require immediate hospital treatment. Risk factors. Who is more likely to develop breathing problems? Some important risk factors include smoking, the biggest preventable cause of chronic lung disease, air pollution, obesity, older age, chronic heart or lung diseases, occupational exposure to dust, chemicals, or smoke. Understanding these risk factors helps us reduce our chances of developing serious respiratory diseases. Diagnosis. When someone complains of breathlessness, the doctor's first goal is to identify the cause. Diagnosis usually begins with a detailed medical history, a physical examination, Depending on your symptoms, your doctor may recommend pulse oximetry to measure the oxygen saturation, chest x-ray to evaluate the lungs, ECG to assess heart rhythm, blood tests to detect infection, anemia or other problems, spirometry to measure lung function, and in selected patients, CT scan or echocardiography. Not everyone needs every test. The investigation depends entirely on your clinical condition. Treatment. One important message: there is no single medicine that cures all breathing problems. Treatment always depends on the underlying cause. For asthma, doctors commonly prescribe inhalers that open the airways and reduce inflammation. For COPD, the most effective treatment begins with quitting smoking, along with prescribed inhalers and pulmonary rehabilitations. For pneumonia, appropriate antibiotics are used only when a bacterial infection is confirmed or strongly suspected. For anxiety related breathlessness, cognitive behavioral therapy, breathing exercises, stress management, and relaxation techniques are often effective. For heart disease or anemia, the underlying condition must be treated appropriately. Never self-medicate or use someone else's inhaler. Always consult a qualified healthcare professional. Home care. If your doctor has ruled out serious illness, there are several healthy habits that can improve breathing. Practice diaphragmatic breathing. Use pursed lip breathing, especially if you have COPD. Maintain a healthy weight. Exercise regularly according to your doctor's advice. Avoid smoking completely. Reduce stress through meditation, yoga, or mindfulness. These lifestyle changes improve lung efficiency and overall quality of life. Emergency signs. Now let's discuss the most important part of today's video. Seek immediate emergency medical care if you experience severe difficulty breathing, chest pain, blue lips or fingertips, confusion, loss of consciousness, or coughing up blood. These symptoms may indicate life threatening conditions such as heart attack, pulmonary embolism, or severe pneumonia. Do not wait, call emergency medical services immediately. Let's quickly summarize. Difficulty in breathing is not a disease, it's a symptom. Finding the underlying cause is essential. Early diagnosis saves life. Avoid self-medication. Follow your doctor's advice. Maintain a healthy lifestyle and never ignore severe or sudden breathlessness. I hope today's video helped you better understand the causes, risk factors, diagnosis, and treatment of difficulty in breathing. If you found this information useful, please like this video, share it with your friends and family, and subscribe to the channel for more evidence-based medical education. If you have any questions, feel free to leave them in the comments below. Thank you for watching. Stay healthy, stay informed, and I will see you in the next video.